today's presentation. Sad demise. It was a very sad news for us, and it was a great loss for the entire Shalakya and entire group of Ayurveda. So, with his pranam to his soul, we are starting today's presentation. So, in the previous class, we have discussed about the anatomical portions, and I think in the last class, Dr. Praveen handled the investigative part, means how to investigate a case of ophthalmic presentation. So by the last two classes, I think you may have some familiar with the anatomical structures and the variations from the anatomy. So the variations from the anatomy that we have to find out in the clinics. So any variation from the anatomical structure is always pathology. So we have to identify the pathology by the investigative methods. So by the investigative methods, we are making some inference about the pathological conditions of the eye. So by assessing or by using all the investigative methods, we are assessing the condition of the patient and we are interpreting in the Ayurvedic way. Because by the diagnosis and the investigations, we ultimately have to start the treatment in the basic principles of Ayurveda. So whatever may be the investigations or examinations, ultimately we have to convert that interpretations to the basic science and the basic pathology of Ayurveda, and we have to derive the line of approach to that patient strictly on the Ayurvedic basis. So today I will give some idea about how to handle a case of ophthalmology in the Ayurvedic basic principles. So in the last class itself, I have mentioned a few factors about the anatomical factors and the dosha dusha, which is predominantly found in the anatomical sites. For example, in the eyelids, vivruddhya mamsam rektam cha. Like that, we have interpreted some facts in the anatomical part itself. So today, by assessing this samprapti, we have to find out the common approach and some specific approach to the ophthalmology cases. So as in the Uttarasthana, Uttaratantra Acharya Susruta clearly mentioned that Nidana Parivarjanam Chikitsa and Samkshepadaha Kriya Yoga Nidana Parivarjanam. So to avoid the etiological factors is the main part of starting with the treatment. So Acharya clearly mentioned that we have to stop the etiological factors so that we can proceed to the betterment of the patient. And the next point is the Samprapti Vikatanameva Chikitsa. So we have to find the methods to stop the progression of the disease, or we have to arrest the Samprapti. So the Chikitsa is Samprapti Vikatana and Nidana Parivarjana. So these two factors are very important, specifically in the case of ophthalmology, because most of the diseases, as we know, most of the diseases are either Asadhya or Yapya or Kritsrasadhya. Very minimum or very less numbers are coming in the group of Sukha Sadhya Netra Roga. So Acharya, in the division itself, Acharya mentioned that once the disease is manifested in a full-fledged manner, it is very difficult to cure. So for example, when we are dealing with the Krishnagata Roga, so only one disease, that is Shuddha Shukla is Sadhya, or Avarna Shukla is Sadhya, and the initial stages of Savarna Shukla is Sadhya. All other conditions are Asadhya. Asadhya means it is very difficult, or we are very difficult to preserve the vision of the patient. So Acharya started the chapter by mentioning that Nidana Parivarjanam hi Chikitsa. So it is prevention is better than cure. The basic knowledge is that it is very difficult to treat a full-fledged ophthalmological diseases. So first part is the Nidana Parivarjanam. So in the Nidana, Acharya Susruta mentioned a lot of factors. That means Ushnabhitaptasya Jala Pravesha, Swapna Vibhirya, Prasakta Samrata, like that. A lot of factors are mentioned by Acharya Susruta. So here the Vegarodha, exposure to Sweda, Dhuma, Chardi Vikhada, Vamanadi Yoga, Bashpagraha, Sukshma Dirikshana, all the factors are Acharya clearly mentioned. So by the history taking, so in some cases, history is everything in ophthalmology, because the patient is presenting with either loss of vision or a history of loss of vision. So if the patient is presented with a loss of vision, we have to identify the factors, or we have to take the history. So nothing to do with the examination without a history. So history is everything. So by the historical means that taking the history, we should analyze the patient's lifestyle and the diet habits and the sleep pattern and the socio-economic or the job status of the patient. All these we have to identify. So if the patient is very prone to take very spicy food, and if it is a diabetic patient, you have to stop that habit. Otherwise, we can't do much to that patient. So all this Nidana is coming under the history taking. By the history, we have to assess the patient by his lifestyle and how this disease is manifested. So, by this assessing the Nidana, we can find out the either Srodha Vaigunya or Srodha Dushti that will happen due to this Nidana. So, Srodha Vaigunya, we have to consider the family history. So, if a patient having a parents having myopia, means both father and mother having myopia, then the child is very prone to develop the myopia. So we have to find out the predisposing factors that are mainly coming in the Srodho Vaigunya. So if the patient is having a history, or his father is having a history of diabetic retinopathy, and the patient is started diabetes, then we can assess the how many years are left for that patient to develop a diabetic retinopathy. So accordingly, we can restrict the patient by convincing that the condition of the patient. Then only we can restrict the Nidana and prevention. We can prevent the further deterioration of the vision. So Srodha Vaigunya is we have to assess from the family history. So if a patient is having a keratoconus history, and if the patient is having a high cylinder developing and progressing high cylinder, then we have to take the corneal topography to identify the thickness of the cornea. Otherwise, the patient will go to the severe form of keratoconus or corneal ulceration. By this method, the Srodha Vaigunya means what are the factors which is predisposed to that condition, we have to assess by the family history. And the next is the Srodho Dushti. Srodho Dushti is mainly happening by the Netra Roga Nidana. Most of the Acharyas have mentioned clearly the Ushnabhitaptasya Jala Pravesha. That is a particular feature of Netra Roga Nidana, which is explained as a common etiological factors, as well as the Ushna Vidaktha Drishti, specific Nidana of the Ushna Vidaktha Drishti also. And there's the similar type of Nidana that we can find in the Paitika Trishna. In that context, Acharya clearly mentioned that the vitiation of Tridosha will happen in the Koshta, especially the Tridosha Rekta Sambrukto Vyatyushmortam Tadokshini. That means the Tridosha and the Rekta will vitiated by the act of Ushnabhitaptasya Jala Pravesha. That means if the patient is having very much fluctuating environments, then there is a high chance of vessel wall damage. That means the blood vessels, that is a vascular damage, which is mainly happening due to the loss of permeability that will happen when a patient is having this type of Netra Roga Nidana. So when we assess the patient's history, if that patient is having a habit of taking bath during the noon hours, in the midday, or if the patient is having pouring hot water to the head. All these factors that we have to take from this Ushnabhitaptasya Jala Pravesha. If that patient is having more long-term exposure, then that the blood vessel will be very much damaged. So if the patient is having a diabetes history also, then that patient definitely will go to a speedy development or an early development of the diabetic retinopathy will happen. So all these are factors which should be avoided from his lifestyle. So when we assess the patient by his history, then also we can assess these factors and advise the patient accordingly. So by the nidana, we have to, by the history taking, we have to assess the srodo vaigunya. What are the factors which are prone to develop from the family history, and what are the srodo dushti that is happening either due to means especially the resurrecta dushti or vada dushti, what or the damage to the blood vessels. All these can happen by the etiological factors. So these are the ahara means Rakta Dushti Nidana and Vidishon. In the Vidishonidhiya chapter, when we assess the Rakta Dushti Nidana, most of the Netraroga Nidana are mentioned in that chapter. So Bahutikshna, Ushna, Madhya, Lavana, Kshara, Amala, Kadurasa, Kulathamasha, all these are the factors which is mentioned by Acharya Charaga in the Vidishonidhiya chapter, and the same etiological factors are coming in the Netraroga Nidana. So we can find that the Rakta Dushti is the key factor which is playing in the Samprapti of Netraroga. So the Rakta Dushti, especially the Viruddhahara. The Viruddhahara along with the Rakta Dushti are the main factor which is playing in the Samprapti of Netraroga. So the Divasapna after Dravasnigdha Ahara, Sevana, all these are mentioned in the Vidishonidhiya chapter. That means exposure to sun and wind, improper bloodletting, all these are. So we can conclude that by the Netraroga Nidana, the Rasavaha and Raktavaha Srododushti are most commonly occurring. So as a common ophthalmological disease, if a patient is coming with a common disease of the eye, then we have to find out the role of Rasavaha and Raktavaha Srodas and the habit of that patient to make this Rasarekta vitiation in the lifestyle. So these also are the more common factors in the Rakta Dushti and Netra. These are a comparison. Comparison means these are the factors which is commonly mentioned in Vidishonidhiya and Netraroga Nidana. That means Vega, Nigraha, Swapna Vibhariya, Charti Vikhada, Kopa, Abhigada, Viruddhahara. So especially the Viruddhahara and the Ushnabhitaptasya Jala Pravesha. Both these are mentioned in the Vidishonidhiya chapter as well as in the Netraroga Nidana. And especially the Ahara, Kadu, Shukta, Aranala, Kulla, Tamasha and Viruddhahara is mentioned in the both these chapters. So when we are so we have to find out the Netraroga Nidana. The Netraroga Nidana will ultimately causing Rasa Rekta vitiation. So what happens when the Rasa Rekta? We know that the Rasa Rekta vitiation is happening in the costa, not in the eye. So the Netraroga Nidana, the Samprapti, is happening in the costa itself, mainly by the Viruddhahara or by the improper lifestyle or means Adi Kadu Tikshna, Ushna, Vidahi, Ahara, the Samprapti happening in the costa. So when this Samprapti begins in the costa, it should be or it should reach the eye. So in Acharya clearly mentioned that Sarvaroga Nidanokte Rahide Kubidamala Achakshushir means the factors which are specific affinity towards the eye. So if the patient is having Ushna Tishna Ahara Sevana, then that patient is prone to develop the Kushtaroga also. Means it can happen anywhere in the body. So to reach the dosha from the costa to the eye, there should be some key factors which lead the vitiated Rasa Rekta to the eye. So that is the Achakshushya Visheshana. That means Achakshushya Ahara. So the factors which is damaging to the entire ophthalmological factors ophthalmology, that we can say it is the that is the previous class that we have mentioned about the surface immunity, that means ocular surface defense mechanism. What are the factors which influence or which hampers that factors? That may be to the Adi Atapa, Dhupa Sevana, or adi achakshushya ahara sevana, all these factors which leads to the or which will start the samprapti of netra roga. So for that, the assistant dosha is the apanavayu. That achakshushar visheshana prayaha pittanusaridanaha sirabhirurdham prasrida. Urdha prasrida. That means that dosha should reach the eyeball by the action of vayu. The vayu which plays a major role in the samprapti is the apanavayu. The apanavayu which is having an adhogati, that will, if it is blocked, then it will start the pradilomagati. So when we assess mainly the vegarodha for the adhovadarotha or shagridvedarodha or mutrarodha or purisharodha, in all diseases, the drishti agnivadha, that means agnimanti and drishti roga are mentioned. So apanavayu visheshan along with the achakshushya ahara vihara are the key factors which leads to the netra roga. So in many of the conditions, if a patient approaching to the OPD, the first line of management will be the apanas Anilovanatvam. That means the Gandharva Hastadi Kashayam or Chiliviladi Kashayam, Ashta Churnam or Vaishwanara Churnam or Hingu Ajadi Churnam. All these medicines that we are prescribing irrespective of the Netra Roga. That means the Apana Vaikunya is the key factor which played the patient in the patient and made that patient to come before us. So irrespective of the condition, we can start the medicines with the Apana Vayu vitiation. That means apana vayu anilobana is the first factor we have to approach in a patient irrespective of the condition. And in the netra roga that we have discussed that the pitta dosha, rekta dhatu and rasa dhatu. So if the ultimately the rekta dhatu is vitiated, but rekta dhatu vitiation means it is the rasa dhatu itself, means the rasa and rekta have a thin boundary. That means sa khallo apyo reso egrt plehano prapya rago bedi. So rasa and rekta having a thin boundary. That means rasa, if it is renchakato, if the renchakato occurs in the rasa, then it is converted rekta. There is no difference between rasa and rekta. So the rasa and rekta, both these dhadus are ultimately, or it is very much close related with the koshta. So the ahara and vihara along with the viruddha ahara are the key factors which making the patient more prone to develop eye diseases and which should be accompanied by the apana vaikunya. So the rasa rekta prasadaka drugs along with the apana vayu anilobana is the common line of approach to a patient if it is coming to our OPD the first time. So in the first time we have to give either Amurdottaranga Shaya with Vaishwanara or Gandharvastadi Vashaya with Vaishwanara irrespective of the condition. So this is the common approach to a patient. So when we assess the Prathama Patala, so we are going to the details of the eye, then we are in the last class itself we have mentioned that it is tejo jalasridam bahyam. That means tejo means it is alojaga teja siragatam rektam bodhavim and tok jalam tok gado rasadhatu. Here also the prathama patala is clearly made up of rasa and rekta. So if a patient is having severe resurrecta vitiation, then that patient may show some intolerance to light or watering of eyes. That means prathama padala doshti that can be happen. It is very much close to the koshta. So with the simple medicines in the koshta itself, we can manage this type of prathama padala dosha vitiation and we can manage it without the treatment in the eyeball itself. So first start with the treatment of rasa rekta prasada rasa rekta prasadaka and apana vayu vaigunya and observe the eye. If the patient is improving, then nothing need in the eyeball. So the Acharya clearly mentioned that the Pancharatra Lenkana, it is very important in the condition of Netra Roga, Pancharatra Lenkana, that means fasting or for the 5 days, that is Akshi, Kukshi, Bhava Roga, Pradishaya, Varnajara, Panjayade, Pancharatrana, Prashamaviyanti Lenkana. Without any medicine, the condition will be subsided with the Pancharatra Lenkana. So what we have to do in that 5 days, we have to manage the koshta, only manage the koshta with the apana, vayu, anilobana drugs and restrict the patient from the nidana and take or advise the patient to follow the proper sleep. Then a minimum vitiation of the eyeball. The minimum problems in that maybe the eyeball itching, or maybe the watering, or maybe the photophobia, or maybe some transient blurring of vision, or transient dryness, that will be automatically relieved by the approach to the costa itself. So the resurrecta in the costa, it is totally dependent upon the pradhama patala of the eye. So the rasa recta vishay, if it is that we have discussed in the last class, if it goes deeper and deeper, then we have to start the local therapeutic procedures in the eye. That is the kriya kalpa. But in the first 5 days, there is no need of starting the kriya kalpa. We can observe the patient, assess the patient. That means these 5 days are the clear-cut assessment of the patient, that we can take the history, we can take the samprapti, or study the patient for the first 5 days without doing anything in the local, just to give the management in the costa itself. So if the rasa recta involvement is somewhat extensive, then the ama association will be there. So we know that the rasa and recta dhatu are closely related to the costa, and they are highly prone to convert into a ama stage. So if the condition is somewhat beyond the costa, then the netra roga will manifest as the amaja netra roga. So that means udirna vedanam netram, raga shofa samannidam, harsha nistoda shulasri yuktam netram amannidam vidu. So these are the factors from which we have to identify the netra is having ama. Not the costa, but the netra is having ama. So if that condition, if it is beyond the ama stage is beyond the costa, then we have to first pacify the ama in the costa, then do the kriya kalpa, which should pacify the ama in the netra. So we have to identify the presence of ama by assessing these presentation. That means udirna vedanam, that we have described that if it is a very mild pain, then we can manage with the costa management itself. But here it is udirna vedanam, the pain is high. And raga shofa samanida means the patient has a severe redness and edema, and karsha nistoda means it is foreign body sensation and pricking pain, and asriyuktam severe watering. Then we have to start the local therapeutic procedures. So if we are seeing this type of condition, the costa management is not at all sufficient. We have to start the local therapeutic procedures also. So why we should understand the sama, that is Lenghana Pralebadibir Vidhanartham Anjanadir Nishedhartham cha. Here Acharya mentioned that if we are observing the ama in the netra, then we have to start Lenghana Pralebadi. That means Pancharatar Lenghana. We have to extend that Lenghana. We have to extend that Lenghana. Don't jump for Snehabana. Give more and more time for Lenghana and start the local therapeutic procedures like Praleba, Sega, and Aschodana, but not the Anjana and Tarpana. So in the Amaja Netra Roga, Anjana is strictly contraindicated. So in the initial stage or in the beginning stage of a condition, Netra Roga, Anjana, so that is highly potent therapeutic procedures like Anjana is not at all sufficient, not at all needed. So here just start with a simple medicines. So Acharya clearly mentioned that Sveda Praleva Tiktannam, Sego Dina Chadushtayam, Lenghanam Chakshiroganam, Amanam, Pajanani Shakti. These are the 6 methods to make the netra devoid of ama. So start with the ama pajana in the local therapeutic procedures. So that is the Sveda, means we can start with lukewarm fermentation. Pralebam, that means netra pralebam means it is nothing but a vidalagam. Start with the vidalagam. If a patient is having a shofa avastha, then start with the vidalagam. Tiktannam means ama pajana drugs we can give internally, and the Sego, start the Sega. Sega means it is also having a high potent to pacify the netra ama. And Dina Chadushtayam, here Acharya clearly mentioned that wait for minimum 4 days, or it is the Pancha, nothing but it is the Pancharatar Lengana. So Sweda, Praleba, Tiktana, Sego, and Pancharatar Lengana it should be, or it is the first line of approach of a patient having ama netra roga. And meanwhile, we have to identify that Anjanam, Sarpishapanam, Kashayam, Guru Bhojanam, Netrarogeshu, Sameshu, Snanam cha Parivarchayet. It should not be done. That means Anjanam. Don't jump for an Anjana. Means many of the patients, if in the starting stage they are applying Anjana. So that is not a proper way to start the treatment. Sarpishapanam, if most of the Netrarogas Snehabana is mentioned. I think only one or two kashayas are mentioned in the Netraroga management. All others are having Krita based. That means Snehabana is the first and first line of management of Netraroga. But Acharya mentioned that don't jump to the Snehabana at the initial stage. And Guru Bhojana means we have to advise the patient not to again do the Nidana. And all these factors should be avoided by the patient in having an Amavastha. So first we have to identify the patient having Samavastha or Niramavastha. So in the Netraroga, so the patient came to our OPD, we started the Pancharatar Lankana. If the patient is having severe problem, then we started the local therapeutic procedures like lukewarm fermentation, Vidalagam, Segam and Aschodhan. And if it is the Amaja condition is over, then the patient will present with the Pakuja Netraroga. So in the consideration of the Chigilsa, that is Pancharata, means again we are concluding the facts, that is Pancharata Lankana is must, Nidana Parivarjana is important as it is the Koshta is associated. So Guru Bhojanam, Varjed Guru Bhojanam. So advise the patient accordingly, otherwise sentence to the otherwise means if it is patient is not following the Patya, then the Nidana, if the patient continuing the Nidana, then that condition will go into a chronic stage. So that chronic stage follow the pathology of Pillaroga. So many of the conditions means having itching, watering, redness are included by the Acharya in a specific group of diseases, that is Pillaroga. Pillaroga means it is a Dirgha Kala Anubandhitu. That means the chronic stage. Even though that condition is not at all very dangerous to the patient, but it will not subside. So that condition we have to manage. If it is a very chronic one and not responding or not completely recovering by our treatment, then think of the involvement of or think of the management of Pillaroga. So in Pillaroga, Acharya clearly mentioned that it is 18 in type. It is Dirghakalabandhitum, that is Vatmavalekam. In that condition, if the patient is not devoid of itching or watering or photophobia or pain, by the local therapeutic procedures, simple local therapeutic procedures, means patient definitely improve, but will not be recovered. So if the patient is not completely recovered, then consider that disease. If it is having a chronic condition, then consider that disease as a Pillaroga. So the approach of Pillaroga is somewhat different from the Amaja Netraroga. So here Acharya mentioned that Vatmavalekam Bahushaha Tattvat Shonida Mokshanam Punar Viregam Cha Pillaroga Duro Bhavit. That means Vatmavalekam. In that condition, we have to do the Vatmavalekha. That is Lekhana procedure. We have to advise. And Bahusha Shonida Mokshanam. That means the condition should be managed with the Jaloga or Rektamoksha. Means Rektamoksha method we can adopt with the Vatmavalekha itself or by the Jaloga. And Punar Virega means give more and more importance to the Virejana. That's Virejana is of having two purposes, by the Vada Anilomana, Apana Vayu Anilomana, as well as the Pitta Shamana or Pitta Rekta Shamana. So both that we have to punar means we have to do frequently. Frequently we have to adopt the Vatmavalekam or Rektamoksham or Virejana. And Nityam Aschodhanam and Anjanam. So the Anjana procedure is a one and only procedure which is mentioned for the daily purpose. So in that condition, advise the patient to do the Anjana. Even though we have discussed that in the Ama Avastha, Anjana is contraindicated. But if that the condition is changed to the Pilla Avastha, then we can advise the patient to start with the Anjana. And Nasya, Dhumapana and Siravidha and Virejana for a complete recovery. So if a patient is not under our control because of his practice of Nidana, then that condition will definitely go into a chronic stage. If it is converted into a chronic stage, then don't stick upon the Amaja Netraroga Chikitsa. Start with the Vatmavalekha or Raktamoksha or Virejana or Anjana for the complete recovery of the patient. And it is a condition which is totally starting as a Amaja Netraroga is an Amloshida. Amloshida is a disease which is a Sarvakshidoka or Amlatyushida, which is having Nidana Annasaro Amaladam Nidaha Pittarektolpanirmalehi. So Annasara, clearly Acharya mentioned that the Annasara, it is going to the Ambla Rupa. So this why the Annasara is going to an Ambla Rupa? Because of the habit of the patient. The patient is taking Kadu Ambla Levanahara more predominantly. So this Annasara is converted into a Amlasara. So this should be restricted by the diet only. We cannot do anything if the patient is not restricting his diet. So the total eye will turn to the shyavalo, the reddish in color. Sa shofa daha pakasru avila darshanam. That means the patient will present with the shofa, daha, paga, and avila. So all these are coming in an amaja netraroga lakshana. So to present with this type of a disease, we have to start the Koshta Chikitsa, and if it is more discomfort to the patient, then start with the local Amapachana methods. Don't consider this as a Pilla Roga. If it is not responding, then only we can consider the involvement of Pilla. So this condition is it is a particular condition having Amanjabanta condition. So in most of the Abhishanta means Sarva Urto Jetrugata Srodasam Sendana Senda. Means the Abhishanta is a Samprapti. It is not a clearly disease. The Abhishanta can be understood in two ways, as a separate disease and as a Samprapti. So the Samprapti means it is happening in the Jetrurtha Bhaga. Means Sarva Urto Jetrugata Srodasam Sendana Senda Ituchade. So it is happening in all over the Jetru. So the patient may having some NASA blockage in the nose, or the patient is having severe sneezing. All these may happen in an Abhishanta Samprapti. So we can manage this condition by a single approach. So the Shushka Alpa Dushiga, Shida Macha Masru Chala Ruja, Nimesho, Nimesh, all these are conditions found in the Abhishanta, and this Abhishanta is definitely having a role of Amayukta in Koshta as well as in the eye. A condition which is very much resembling with all these Samprapti is allergy conjunctivitis. So in this allergy conjunctivitis, the patient will present definitely with an amaja netra, or it is having a acute exacerbation of a chronic disease. So if an acute exacerbation will happen, definitely that patient is presenting with a Amaja or Amayukta Netra Roga. So the common allergens may be the pollen, grass, animal dandruff, dust, or many things that can happen. So first line of approach is the Nidana Parivarsana. Identify the factors which is very much written to the patient and avoid that. Then only we can think about the treatment, and we have to see the vascular response, cellular response, and the conjunctival response. So that line of treatment, Acharya mentioned that Pragrupeva Sandeshu Tikshna Gandusha Navanam Kare Dupavasam Cha Koba Danyatra Vatajan. So the Amajanathroga, all these are same. At a different context, Acharya emphasize on the importance of Amapachana in Netra. So Pragrupeva Sandeshu means if the patient is presenting or start to present, if the patient is having severe sneezing and itching in the eye, so that condition cannot be considered as a Netra Roga. It is only Netra Roga Pura Rupa. So in that condition itself, we can start the Abhishanta management. And Pragrupa Eva Sandusha Tikshna Gandusha Navanam. Also, all the Tikshna Nasya and the Tikshna Gandusha. Both these are for the Sroto Rotha Nivarana, or for the Ama Pajana. And the Kare Dubavasam, again the Pancharatra Lankana. So all these conditions we should keep in mind when we are approaching a patient having allergy conjunctivitis. And Dahoba, Deha, Raga, Asru, Shofa, Shanti, Vidalagam. So the Vidalaga is clearly indicated when the patient is having Daha, that burning sensation, Upadeha, that means increased discharge, then Raga, redness, and lacrimation. All these conditions, if the patient is presented with this condition, start with the Vidalaga. And the Amayukta Netraroga, clearly Acharya mentions Sweda Praleba, that Praleba is the Vidalaga. And in chronic conditions, that is Vatmavilekam Bahusha, that we have clearly mentioned that if the patient is not, definitely that patient will respond to our treatment and it will be subsided. And if the patient is again going for the same etiological or nidana, then the patient will again develop that condition and it will go into a chronic stage. In that condition, we have to adopt the Pilla Roga Chikitsa. Then no need to continue the Amanetra Roga Chikitsa. Then we have to consider the Pilla Roga Chikitsa by the Vatmavilekha, Rektamoksha and Virejana along with the Anjana. That is the ultimate cure for a patient having chronic eye disease, especially the conjunctivitis. So this is a patient who presented with a chronic allergy. Means this type of cobblestone appearance will not happen within 1 or 2 months. It will happen with years of exposure. So years of exposure means it is nothing but it's a Pilla Roga. We cannot consider it as a Utklishta Vatma as a single disease or Klishta Vatma, but we have to consider both these diseases that Acharya mentioned in the Pilla Roga also. So start with the Pilla Roga. Here the first and foremost treatment is the Vatmavilekha, that do the Lekhana Karma. Then only the patient will get relief. Otherwise, this cobblestone appearance will not go into a smooth surface. That means the ultimate aim of our Lekhana Karma is the Samam Nakhanibam. Just like the nail bud, we have to make that much smoothness to the tarsal conjunctiva. So make that surface very much smooth so that it will not irritate the cornea. So the patient will be free of watering and photophobia. So start with the Lekhana. And this is the case that we have managed in our OPD. That is patient presented with the severe cobblestone appearance. That is a chronic allergy, more than 15 years of allergy. And the child is having around 16 or 17 years. Means at the age of 1 or 2 years, the patient started. And as we know, the management of this allergy conjunctivitis in modern is especially on the steroids. So long-term steroids, the patient cannot tolerate the long-term steroids because of the fear of developing cataract as well as glaucoma. So the doctor itself will advise the patient to take an alternative because that condition cannot means the patient, if the patient is not survive without steroids, then it is better for them to opt another line of management. So here the cobblestone appearance was very, very large. That means by the simple Lekhana only that is not at all going to subside. So we have done the Chedana also. That means that is the giant papillae that we have done the Chedana, and after the Chedana we have done the Lekhana Karma and the thick projection that is made into a smooth surface, and the patient immediately get rid of the photophobia and the watering. So as we know, that is a chronic condition. That means Mavalekam Bahushaha. That means it need a long term or frequent Lekhana is necessary in this type of a disease. So that if a patient is presenting with an Abhishanta, if it is not properly treated, Ajay clearly mentioned that Prayana Sarve Nayanamestu Bhavant Abhishanta Nimittamula, means that may develop into severe eye complications. That in the anatomical portion itself we have discussed that the conjunctival epithelium is the anatomical structure which is constantly exposing to the environment. She is exposing to the dust, dry and sunlight and all other chemicals. This conjunctiva is constantly exposing. Means if that conjunctiva to resist all these factors, the ocular surface defense mechanism or the ocular surface immunity should be very, very good. That means the vitamin A presence. That means the role of vitamin A is very evident for the conjunctival health. So if that patient is not having proper ocular surface defense mechanism, that means conjunctiva will start reacting. That means allergy conjunctivitis or some sort of infective conditions of the conjunctiva will start. So as the conjunctiva is infected, we have discussed that the one layer of conjunctiva is continuous as the epithelium of the cornea. So if the conjunctiva is involved, that may leads to the keratitis. That means it is keratoconjunctivitis. So that may this infection is going to the cornea. That means Krishna Mandala is also involved. As we know that the cornea is having 5 layers. If the endothelium of the cornea is continuous with the epithelium of the uveal tract. So if the cornea is constantly involved and infected, then automatically the uveal tissue will also be involved. That means the keratitis is in a chronic keratitis, there will be a presence of subclinical iridocyclitis. So that infection is going to the uveal tissue. The iridocyclitis means anterior uveitis. If it is not treated, then it is going to the posterior uveitis. That means choroiditis. That choroiditis, if it is not treated, it is going to the chorioretinitis. So the starting from the conjunctival epithelium, there is an anatomical connection. That is one by one connection to the retina up to the retina. So a simple conjunctivitis, if it is left untreated, can infect up to the retina itself. So the abhishanta means the conjunctival disease, it is definitely the all type of conjunctival disease will manifest as an abhishanta. So this abhishanta should consider it as a samprapti here, and the samprapti vikatana is very much important to maintain the proper eye health. So this is a specific type of procedure, that is avagunthana, mentioned by Acharya Vagbada in the management of Amayukta Netraroga. That means avagundhanam shula daha asru shwetu kandu usha paga kleda upadeha haram. So a lot of indication is mentioned. All these indications are the clinical presentation, that is symptomatic management is mentioned. So here what are the presentations of the patient? If the patient is having severe redness, then edema or kleda or upadeha, then we have to start the avagundana, but change the medicine. No need to continue the same medicine in all these conditions. So this avagundana is a specific type of medicine mentioned in the Abhishanta Pratisheda, and its drugs used are the Shvedalotra, Nimbapatra and Marija. This Marija can be used only in the patient is having Shwedu and Upadeha, not in a patient having redness. So above this medicine is Manashila, Yashti, Mathuga, Shatakupa, that is Shadahua and Anjana. All these are medicines are mentioned. And in some type of allergic conjunctivitis, that is Nimbapatra and Haridra. Nimbapatra and Haridra made into a paste and dipped in the Dhanyamala and applying as an avagundana. So it is a very effective. As we know, the Dhanyamala is very much effective in reducing the Shwedu, and the Nimbapatra and Haridra are very much effective to control the hypersensitive reaction as well as itching. So this type of avagundana is very much effective in the acute management of allergic conjunctivitis. So if the patient is having severe allergy or severe itching with edema, then start the avagundana as early as possible to subside the condition. So we can take it as an emergency management of Ayurveda in handling this type of symptomatic conditions. So I think we have covered as a just if a patient is coming to our OPD, how to manage that condition that we have covered. Now we are moving to some type of ocular surface diseases. Ocular surface disease that we have mentioned, it is mainly on the exposed part of ocular area. That means the bulbar conjunctiva, tarsal conjunctiva, tear film and eyelids. So in this type, the most common disease which is manifesting is the dry eye. So in dry eye means in the initial stage, it is having only dryness. The dryness can happen either by the Vada vitiation or Kapha. Here there is no role of Pitta in the initial stage. So this condition can happen without Paga. That means Vada, Kapha in origin. And if the Vada is vitiated and Kapha is having very much reduced stage, then there will be friction. Means if there is a loss of lubrication, then there will be friction. If there is friction, there will be spark. The spark means it is the Agni. That means there will be Paga. So if this condition is going to a stage of a chronic stage, that means it is a Pilla Roga. Means Shushkakshi Paga is a Pilla Roga. In Shushkakshi Paga, it is a disease which is mentioned as Ashastrakarta by Acharya Susruta. No surgery is mentioned in Shushkakshi Paga, but it is a Pilla Roga. In Pilla Roga, the Vatmavalekha is mentioned, so surgery can be done. So if the Shushkakshi is having a chronic stage, then Acharya permitted to do the surgery, including the Rekta Moksha as well as Lekhana. But in the initial stage, if it is having only Shushkakshi, then no need of any type of surgery or Vatmalekha, we can manage. If it is having Vada Kapha in origin, then Vada Kafakshi and Vada Vritti, then we can easily start with the Snigdha. Snigdha Prayoga, that is Snigdha Aschodhana or Snigdha Piju, that we can easily start. If there is Paga, then there is a role of Pitta and Rekta. In that condition, the patient will present with Ama. That means the patient will present with the photophobia, watering, redness. All these presentation will be similar to that of Amaja Netra Roga. So we cannot administer the Krida in the initial stage if that condition is having the Pagavastha. So if a dry eye is coming to our OPD and we can do the Upashaya and Upashaya. We are just instilling one drop of Krida as an Aschodhana. If the patient is having a severe type of irritation, then we can identify that there is an Pagavastha. That means here the Pagavastha means there is some ulcerations. The ulceration can happen only in the cornea. So the dry eye having some epithelial defect in the cornea will not accept the Krida or Kridaschodhana or any type of Snigdha Kriya in that condition. For that condition, we have to manage the ulceration first. If the ulcer is cured completely, then only we can start the Tarpana or Nasya in that stage. So if a patient is coming to the dry eye, it is our duty to find out is there any Pagavastha or it is without Paga. So if a patient having dry eye means Vada, Pitta, Vriddhi and Kafakshaya is happening, Ruksha, these are the conditions, Ruksha, Daruna, Vatmakshi, Kristonmela, Nimiranam, Shidecha, Shula, Paga, all this can happen in a patient having dry eye. So in chronic conditions, there will be the ulcerations. The ulcerations in the cornea. In the previous class, Dr. Praveen clearly mentioned that the corneal ulceration should be identified by the fluorescent staining. So if a patient is coming to our OPD having a chronic dryness, means the patient is not at all completely cured from the last long years, then immediately go for the fluorescent staining. So if that staining is positive, that means consider the Pitta Vritti. In that condition, the best method to start with is the Sega. Sega with the Manjishtadi Sega or Utpaladi Sega. Don't mix Krida in that condition. So if the Sega that we are starting, that is Pitta Rekta Shamana Sega, and it will not vitiate the Vada or Kapha. In that condition, after the ulcerations are healed, then only we can start with the Krida. So, Krida, then if conditions of ulcerations adopt Vrana Chikitsa here. In that condition, if there is ulceration in the cornea, then we have to start with the Vrana Chikitsa, that is Sadhya Vrana Chikitsa. Sadhya Vrana Chikitsa, to understand the Upashaya and Upashaya, we can start with the Netra Pichu with the Durva Krida. That means in applying the cotton tip in Durva Krida over the closed eyelids. We can start. Don't apply on the direct Krida to the direct, or we can apply the Krida with the mixed with the honey. That means it is a Sadhyavrana Chikitsa. We are giving that medicine to heal the ulcer, not to heal the dryness. So if the ulcers heal, then do the Kshirasegam, Anjana, Tarpana and Puttapaga. So the Anjana, Tarpana and Puttapaga, that is a Ropana Puttapaga, is very, very effective in the patient having dryness, dry eye. But that should be done only after complete cure of the ulcerations. Or in severe dry eye, then go for the Tari Prayoga. Tari Prayoga means it is a particular type of medicine in the paste form applying over the closed eyelids, that just like the Netra Pichu. So means usually the Kadali and Eshti, means the Kadali Phala along with the Eshti Churna made into a paste and applying in a cloth, thin cloth, and which is putting over the closed eyelids. It is a Tari Prayoga. That Tari Prayoga is just like an Avagundana. It is an immediate management of severe dryness. Means if a patient is having an acute exacerbation of a dry eye, then we can start or we can advise the Tari. So when seen in old age, means if a patient is presenting with an above 60 years after the menopause, then we have to consider the Rasadhatu Kshaya here. That means Rasadhatu Kshaya, the associated with that in the previous class we have discussed that the Rasadhatu has a total connection with the Netra Jala and Jihwajala, that means xerostomia and xerophthalmia that can happen with the Rasadhatu. So if then we can ask about the condition of the mouth. If the patient is presenting with severe dryness of mouth, xerostomia, then xerophthalmia, in that condition we have to manage with the systemic therapy along with the local therapeutics. So in the management you have to include the Rasayana Chikitsa, Kritapana, Pratimarshanasya and Snigdha Ashodhanam here. As a local therapy, we have to start the Snigdha Ashodhana, and as systemic management, we have to start the Kritapana or Rasayana if a patient is approaching to our OPD with the dryness in a old age. So this is the main factors that we have to give emphasis on the ocular surface disease. And when we are moving to the cornea, that we have discussed that the Asrijaha Krishna Mandalam Tad Madrijam. So even though the cornea is having no blood supply, most of the diseases are explained in Ayurveda as the Sarekta Sannibhata. That means Rekta Dosha involvement is the prime factor in corneal diseases. So Vada, when combined with the Rekta, it is having high sensitivity. That is, it is evident from the Rektaja Shirashula. Rektaja Shirashula, Acharya mentioned that Sparsha Sahatto. Or in the Rektaja Vada Shonida, Acharya mentioned that it is Sparsha Sahatto. So from where this Sparsha Sahatto is coming, it is the combination of Vada and Rekta. So when this patient is presenting with the Sparsha Sahatto, it is nothing but it is the photophobia. So this patient is presenting with the photophobia, then we have to consider the role of Rekta and Vada in the management. So the high sensitivity, it is a Sparsha Sahatva, which is seen in the Rektaja Shirashula and a cardinal feature of Rekta involvement. So Vada, when combined with Rekta, then the pain and light intolerance will be presented by the patient. It is nothing but a photophobia. So if a patient is presenting with the photophobia, we can start leaching without considering any dosha and doshya. So it is a blinded treatment that we can adopt in the patient which is presented with the photophobia is the leaching. So in a corneal disease, it may be the severe conjunctival congestion, or just like keratoconjunctivitis, or maybe due to some keratitis, or maybe due to some iridocyclitis. All these conditions patient is presented with the photophobia. So the first and foremost management to manage this photophobia is the leaching therapy. So this leech therapy will immediately subside the Rekta and Pitta involvement, and the patient will be immediately get rid of the photophobia. So when we consider it is a symptomatic condition, that means the symptomatic conditions to relieve the photophobia is the exclusively the leaching. And when we consider the corneal disease, it can happen in the three methods. That is, it may be infective, or may be injury, or by opacity. So the corneal injury, it is a very common presentation in the OPD, and that injury that we have discussed in the last class means corneal epithelium is a very strong immunity providing structure which can resist most of the organisms present in the ocular surface. But if it is damaged, then it invites the infections which is already present. It is the organism which is already present in the conjunctiva will attack the cornea if the epithelium is damaged. So the epithelium, the health of the corneal epithelium is very crucial to maintain the ocular surface or the corneal health. And if that infection becomes more and more deep, then it will leave an opacity. So when we consider the corneal diseases, the Vadika condition, the Vada is a factor which gives the structure of, or which maintain the structure of an organ. So the size, shape and smoothness, it is controlled by the Vada dosha. So if a patient is having an altered shape of the cornea, that is clearly it is keratoconus, then we have to consider the involvement of Vada dosha. And vascularization and sensitivity that we have already explained. If it is a neovascularization or high sensitivity, then we have to consider the Pitta Rekta. And if it is having edema or opacity, then we have to consider the Kapha dosha mainly. But all these conditions, as we know, it is embryologically originated from the Rekta. So all these conditions, we have to give some importance to the Rekta Dhatu also. So the choice of the treatment will depend upon this. So if the patient is presenting with corneal disease, assess the condition by this method and just understand the dosha involved that condition and to do the treatment. If a patient is having a keratoconus and no ulceration, if a keratoconus having ulceration, then we have to consider the pitta rakta dosha. We cannot do the sneha or tarpana in that condition. We have to go for the jaluga to get rid of the photophobia and redness. And if a condition with the kapha dosha, then the patient will present with edema and opacity. Then go for some tikshna anjana prayoga. If it edema that we have already discussed, just go for the vidalaga, having some tikshna drugs or dhanyamla. And opacity, we can start with lekhananjana. So if a patient having opacity, we can start the lekhananjana. But if a patient having a mild form of corneal ulceration, we cannot do the anjana karma. That means if the pitta rakta involvement is there, it is not, the patient cannot afford the lekhananjana or any type of anjana patient cannot afford. So by this presentation, just understand the dosha, dushya and manage the condition accordingly. So that in this we have discussed in corneal ulcer, the first line of management to find out the extensive nature of that ulcer. It is strongly single or it is a multiple, just like a superficial punctate keratitis, just as a part of corneal, means contact lens wearing or due to some viral infections. Just check what extent this staining is happening, and if it is immediately, means the staining or the ulceration started immediately after some exposure to foreign body or some chemicals, then we can start the bandage with durva and honey just as the sadhyavrana chikitsa. Just start the sadhyavrana chikitsa if the patient is having an acute corneal injury. And if it is having a chronic type of infection, then we cannot manage with this type of bandaging. We have to adopt the Savrana Shukla Chikitsa. That means Acharya clearly mentioned that is Doshanurodha Shukleshu Snigdha Ruksha Varakridam Tikta Murthasur Sravo Reka Sekadi Jeshide and Tristrivat Varana Bakum Shata Shukle Kridam Pipeda Sirayatu Prahari Dektam Jaloga Abishalocha. Here the Acharya mentioned that don't go for a simple line of management. Manage the condition as a chronic one and start with the Snehavana itself. Start with the Snehavana, do Virejana, that means of Tikshna Virejana and Rektamoksha or Jaloga to manage this type of chronic ulcerations. So the Rektamoksha and the Pitta Rekta Shamana Chikitsa are highly indicated in a chronic infection of the cornea. So if the patient is presenting with chronic keratitis, means if a cornea is involved, then that will take time because there is no antibodies from the body will reach there because it is an avascular structure. So if an ulceration happening in the cornea, usually it will take a chronic course to heal. So up to the complete healing of that corneal ulcerations, we have to continue the treatment. So continue the Jaloga or continue the Kritabana or Virejana, just like the Pillaroga. So we have to manage or do more frequently up to the complete remission of the ulcerations. And these are the conditions in which the Rektamoksha is mentioned in the eye disease, means Puyalasa, that is